Hello, everybody.
Hello, welcome back to another episode of The Journey, the human experience to spiritual enlightenment. And today I'm going to call you our resident medical advisor at this point, right?
That would be me.
Yes.
Awesome.
This is Yoli Castillo. Yoli, would you like to tell us who you are and what you do?
Well, who I am?
Yes.
I'm Yoli Castillo. And I happen to be a nurse practitioner, and I can practice in the state of Florida medicine independently. And I have been a nurse for the last 40 years.
Wow.
Which only means that I am old.
Well, you look wonderful.
We're gonna go with wise and
Good.
experience.
Yes.
There you go. I like
There you
those
go.
words so much better. It's all about
That's
the
a lot
choice. It's all about the choice and how you express it, right?
Exactly. So on this episode, we're going to talk a little bit about the changes that happen, not just physically. We always talk about the spiritual side, but we want to know if there's like an actual physical to any type of change to different types of modalities. And we were kind of curious about this. Obviously, we've been in our journey and we've been trying different things, but even medically, with for you guys that know that Sean is a veteran, so he goes to the VA, and they had suggested that for sleep issues that he
And
start
stress, sleep and stress. They've sent me to two different meditation courses.
meditation, and we were like, what?
Yeah.
This is like a medical, medical stuff. Why are they doing meditation?
Yeah. and
So-
they practice mindfulness meditation, so it seems less spiritual. They don't even talk about spiritual stuff. It's more just focus and be mindful and visualize the forest and the trees and take deep breaths, that kind of stuff.
So,
So we've taken a lot of walks on the beach and taken deep breaths.
yeah,
With the
we have.
VA. With the VA.
So when we talk about the spiritual side, obviously there's a spiritual connection for a lot of people when they practice yoga and meditation. Let's start with meditation. Have we seen or experienced anything that is a physical reaction to meditation that has either improved health or made it worse?
And that's a great question, because sometimes people want to know, why is it that I'm going through this meditation? Why is it that Sean, and thank you for your service, Sean.
Thank you.
Why is it that people are encouraged to go through this mindful meditation? And what does that truly mean? And it truly means grounding yourself in the moment. And we were talking about that not too long ago. How is it that you take the moment and just shut out all of the other noise that really impacts and really has an effect on you? How do you block all that off so that you can truly be into yourself? And what happens is studies that have actually taken place really dictate over what it is that your body goes through when you're able to go through this meditation, through this internal awareness. And so your blood pressure actually decreases. And that's one of the studies that Harvard actually put out.
Yep.
And it was, what happens to the physical being? So your blood pressure lowers, your respiration rate lowers, your pulse rate lowers. And so that becomes more of a state of being more in touch with yourself. How many of us have actually gone to get a massage, and in the moment there's quietness, there's very serene surroundings, lights are less blaring, if you
Yeah.
will, and so
And at that point, like, nobody needs you. Nobody like, you have this moment just to disappear, and it's okay.
And it's not just disappear. It's disappear from your current state, but it's very much reappear so that you know who you are in the moment. And so your connection with your therapist at the moment that's actually doing your massage, as you're finished, aren't you always like jelly legged? Don't
Yes.
you get up and
Yeah.
you're kind of wibbly wobbly and trying to figure out, what just happened?
Yeah.
Everybody heard it with me, from Yoli's mouth to Sean's ears. Massage, meditation, same thing.
Same thing. Same
Going to
thing.
meditation.
So,
There's a difference,
Go to
but
meditation.
yeah.
but the effects are the same, and
Yes.
many times you're able to, and you would know, Sean, recently through all of the things that you're going through. How do you quiet the noise? How do you make that happen?
I am, so the VA is not great at teaching that portion. So they don't really, they're just more like, here, listen to this. And it's like guided meditation classes. And then they take a little while and talk about stress, which, I think is very interesting because they tie that to blood pressure in some of their courses. So they're basically saying, you know what, when you meditate and you relieve stress, a symptom of that stress relief is, guess what? Your blood pressure is going to come down. So they focus a lot on that, but quieting the noise is not a focus of them. But that's stuff that we're seeing in a lot of other places that we're having experiences with or doing research on, and for me it's very difficult. It's very difficult. I mean, you've known me for quite a while now. My head's just constantly going. So that's always something I have a big challenge with. So I will actually do a meditation, take a break, and then do a meditation again. And a lot of times I find that helps quiet that noise.
Like pregame the meditation?
Almost pre-gaming, and I think we've talked about it. I think we've talked about that before, but that's what I have to do sometimes. But in other cases, a lot of these modalities that we've been talking with to tell us, stop fighting the static, stop fighting the noise, stop fighting the thoughts, and just let them pass. And just let them pass and then
Acknowledge
refocus
them,
on
move on.
something
But
else.
achieving that is probably the hardest. And
Correct.
some people have a rebound effect, and what they will experience is because they want to quiet the noise, they make
Focus on nothing
more
but that.
noise.
Exactly.
And so it has an
That's-
inverse effect.
That's their fight with the let it pass. Because if you fight it, we make more noise, like you've said. So you
Correct.
fight it. So the one that I'm finding best now came from speaking with the Kundalini people. And they basically were saying inner method. Yeah, they did the Kundalini activation with us. They were saying basically just let it flow. Try not to give it any power. Just, okay, this thought came to my mind. I'm going to let it pass. And then I'm going to refocus back on my breathing, or I'm going to refocus back on my chanting or whatever you may be doing in your meditation. And, I found a lot of help in that. And I'm not great at focusing on my breathing or focusing on chanting. I don't really do the chants, but I like to meditate with music, and I can refocus on maybe a drum line that's in that music, or maybe waves that are in that music, and then that can bring me back to a focal point.
So haven't you ever experienced a moment that you're listening to a song and you really connect with that song?
Yes.
And that connection becomes a wave of emotion, and then everything else goes away.
Yeah.
And it's only either the lyrics or the sound that comes from that song. And doesn't that make you achieve that moment of the quiet just happened?
It does, and it was quite comical, actually, because I still think Betty was messing with me, but I kind of was sitting out in the lanai earlier today, and I was listening to the song, and I just kind of closed my eyes, and I'm hanging out, and I'm like, oh, it's kind of a meditative song. And then after the song was over, Betty's like, there's a rumor there's a demon in that song. And I'm like, what? I'm like, what?
And that's
Why did you bring that to my attention when the song started, not at the end? What are you talking
Okay,
about?
so he's listening to a Lady Gaga song.
I didn't even know what the song was. I'm just listening
to.
to the rhythm, and I'm like,
And then I'm like, did you hear the demon? And he's
like, what?
What?
Wait a minute. Now I need to know what song were you listening to?
It was definitely a Lady Gaga song. It was that
Yeah.
curious disease.
Yeah.
Yeah.
I don't even know the song. I was just listening to the rhythm of it.
Well,
That's
yeah, we
where
had
you were saying.
just a-
I kind of meditated into that rhythm of the song. It had nothing to do with the words. I didn't even
Yeah,
notice
we
it
had
was
Big
Lady
Mama
Gaga.
radio on, so it was, it was just an array of different music, and that pops up, and
And I'm
I
like,
just
great.
see him
I've
sitting
been
there. I'm
I've
like,
been meditating with demons, and nobody's saying anything to me.
But did you have a connection?
but did you?
I don't want to talk about it.
Did your journey
I don't want to
take
talk
you
about
anywhere?
it. No, I did not have any kind of connection. It was just relaxing.
So I'm going to kind of go head on in this direction with this. I see. Oh, you just scrolled right past what I
Nope,
was about
go
to. All right. So, I wonder if this is something. Do medical professionals tell their senior parent or patients or patients that may have some sort of memory issue about meditation? Because it says meditation can enhance attention, memory, and mental clarity. So should that be a kind of a part of their daily routine of maybe doing a little meditation to help, kind of make their mental clarity a little bit stronger?
So that's a two-part question, because you asked, do medical professionals encourage that? And it depends on the professional. It depends on what their importance is on it. For the most part, unfortunately, the answer is they really don't focus on that, because the focus is on your physical health. So finding the right practitioner that will, whether it's physician or otherwise, that will focus not just on your physical state of being, but on your emotional state of being. That's where you'll get that balance of having someone that will have those conversations with you and encourage you to have those other types of experiences.
holistic.
Yeah, that's
More
also.
holistic.
That's something I really hadn't thought about with, especially myself being prescribed it through the VA.
Mhm.
I wasn't just prescribed it through a therapist. I wasn't just prescribed it through a psychiatrist. I was prescribed this straight from my doctor who said, hey,
Your general practitioner.
you have
yeah.
some of these issues, you have the blood pressure, blah, 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 blah. Maybe it'd be good for you to take on a meditation practice. And I was like, well, I really don't know how to do that. Next thing you know, he got his pencil and paper out and he whipped off a prescription for both. And I'm like, are you kidding me?
I'm like,
thought
there's
he
a
was-
prescription for
I thought he was-
meditation?
I thought he was pulling my leg, and
Okay.
he didn't write it down, obviously, he put it in a computer, but next thing you know, next day they called me and it was legitimate. And I was like, I thought he was just messing with me. And then we went through the program. But do you see that coming more into the medical field as to where they're more aware of saying, hey, you have a physical issue, but maybe meditation can help relieve some of that, like the stress and blood pressure, things of that nature.
And that, what you just said, medication versus meditation.
Mm-hmm.
So sound alike, totally different options.
Yeah.
And it totally depends on and that goes together with the journey. Does the practitioner have their own journey? Do they really understand that there's more to it than the physical?
Yeah.
That there's more to it than I'm going to write you a script. Here you go. Nowadays nobody writes a script. It's
Yeah,
all
you just
all
call
on
it
the
in.
computer. It's
know-
funny because I just said it, and as soon as I said it, I was like, they don't do that anymore. It's
They
on the
don't.
computer, but
But we refer to it the same way. But
yeah.
in essence, they're giving you methods to be able to improve your health.
Yeah.
Now, your health, this is where we're going with this. It's not just physical health.
Yeah.
And if you really look at it, it's physical, it's emotional, it's everything, even about your surroundings. And how do you make those surroundings count towards your state of well-being?
Have you seen someone's mental health be so poor that it affects their physical health?
Absolutely.
Is that
Absolutely.
a common thing?
That is a very common thing. And which one do you address first?
The mental or
Exactly.
the physical? That's hard.
And it
Exactly.
depends on the person. Because
And I asked that question because with me, it's stress. That's part of my blood pressure. And my doctor, over years of working with me, has decided that's probably a better direction to look into than the medications that don't seem to help me. And that's what kind of led to the meditation, which was an interesting, change of pace to, just take more pills. But that
And
mental issue is
Yeah.
of absorbing stress and dealing with it too much is physically causing me to have high blood pressure, which I thought was very interesting.
let's pepper something into my personal life into this so that you all know that we do horseback riding.
Yeah.
And there is this proven science that horses have a way of being able to relieve stress with others through hippotherapy is what it's called, equine therapy. And so many children who have autism, so many children who have other types of behavioral conditions, people who have PTSD, people who have Alzheimer's, they are very much encouraged to be able to go through hippotherapy, to be able to achieve the rhythm of the horse takes you into that transient state. And there's this entire book of science that has actually connected. What does it mean? Why is there that connection with these animals?
Wow.
There are people who are deathly afraid of them.
So I'm sure you know this already just from that conversation, but Dr. Google said, yes, horseback riding can be a meditative practice encouraging mindfulness and present moment awareness through rhythmic motion connection with the horse and focused on attention required for riding.
Well, Dr. Google gave you
Dr.
that.
Google just said the same
Yoli
thing as
just
you
gave
did,
it to you
pretty
before
much.
Dr.
So-
Google even gave it
Yeah.
to you. And so that's the whole concept of whatever it takes to get you into that moment. That's what you should do. Whether it is listening to music, whether it is doing some sort of hobby, why is it that people are encouraged? How many NFL athletes are encouraged to go through crocheting? It totally disconnects to what you're doing and being able to perform something that takes your mind off of the moment and leads you to a different place.
The mind is so powerful. It's just, and one of the things that we've kind of come across the more and more that we go through all these different types of modalities and just studying them, they all lead you back to be in the present moment. If you think too much about your past, or you get a depressive type of state of mind. If you think too much about the future, now you have anxiety. So what they all urge you to do is be mindful of who you are right now in this place, in this space, and then all these other worries should start getting further and further away from you, and then lessening that depression or anxiety. So, or, I guess, when it comes to medication, why can't it be both? Why can't it be and instead of or? I think that maybe having meditation as a support for when people are going through, that they do need medication for, and that's a very real thing that they have to work through. But it looks like the numbers can be reduced. So if you have like a higher dose maybe of a certain medication and you start doing meditation and it starts like kind of relaxing your body, would that affect the dosage and maybe
absolutely
at that point be more helpful, I guess, would be the outcome is, I mean, of course, everybody would love to be on no medication, I don't know how possible that is and what the degree of that person having to be on medication. So we're definitely not saying don't, but maybe this will help you reduce or manage your meds a little bit better.
And certainly either augment or actually have it be a either, I don't even know what to refer to it as, but just an adjunct therapy that you would do to be able to support what it is. Yeah. It comes to a moment that there's only so much you can prescribe before that actual prescription does more harm than it does well.
Yes.
So you're putting all of these chemicals into your body, sometimes very rightfully so. Your body may need, if you are an insulin-dependent diabetic, you definitely need the insulin. Those types of things, for sure, they're appropriate. But what if by doing some other things that are not like that, you can actually dial it down. You can have better body reactions to these things. Isn't that
just
interesting?
From us starting the journey in November, my doctor is meeting with me again next month to discuss bringing my blood pressure medication down.
Yay.
Yeah.
Good for you.
Just from the level of meditation we've been doing.
Yeah.
That's what it seems to be. So time will tell, but yeah.
We'll find out for sure.
That is definitely something to celebrate. Live the moment. Celebrate the moment.
Absolutely. Well, I think that this topic is obviously about being mindful, meditation, and meds.
And meds. Now it's meds.
So we did.
And we had Dr. Google speak in.
Dr. Google
we had Yoli here. It was an amazing day.
Just anything that you decide to do for yourself, even if it's just go for a walk, just be mindful of that moment. Just think about where you are, what you see, and enjoy that present time. And maybe, just maybe, it'll help you with all your other ailments that are combating, in your body and need that time out. So, and it doesn't hurt, right?
Take a
minute.
That perfect moment of harmony.
Yeah.
Where things kind of
just however you meditate.
Mesh together.
Either by horse riding, walking, meditation, music, however you disconnect, find your place.
Worst case, you're going to chill out for a little bit.
Yeah.
You're going to relax. You're going to dial it down.
And have a good time while you're doing it.
Exactly.
So I think that's all we got for you guys today, right?
Enjoy, everybody.
Thank you. See you next time.